Marcela Suarez. She's a Promotores Program Manager with CMAR Community Health Centers. She'll be talking today about how CMAR Community Health Centers linguistically and culturally appropriate health care services and health information to the farm worker community in Mount Vernon. Welcome, Marcela.
Thank you, Nina, for the introduction. Good morning, everyone. I'm very excited to share some findings about the social determinants of health research the Migrant Seasonal Agricultural Worker Promoters Program conducted during 2021 and 2022. This is an ongoing project, and we intend to continue adding relevant information about our local farm worker community.
Thank you, Marcela. Just wanted to ask, if having trouble hearing you, if you could maybe talk a little closer to the.
Excuse me, I cannot hear you, Nina.
I'm having trouble hearing you, so I think it's a sound. I want to make sure that you want to say something, make sure that I can hear you correctly. That way, everyone. Yes.
Can
okay,
you
maybe
hear me better?
It's a lot better. Yes, if you speak closer to the speaker, that way we can all hear. Thank you. Welcome.
Okay, thank you. The CMAR Community Health Centers Migrant and Seasonal Agriculture Worker Promotores de Salud program is a multidimensional model of community health workers that invests all its efforts and resources in building an environment of trust with the farm worker community in Skagit State and in Washington State's Skagit and Whatcom counties. Promotores de Salud are the front line of this program and act as a bridge between community organizations and the farm worker community by opening access to medical, dental, and mental health services, as well as health education information, particularly relevant to this population. This program also addresses the needs of the farm worker community, empowering them to overcome the unique barriers they face. Skagit and Whatcom counties are home to the majority of Northwest Washington's farm worker population, which comes from Mexico and Guatemala. Nearly 60% of this population in the two counties belong to indigenous communities. Why did the EMSA Promotores program decide to start this research? As a response to very little information about the local farming community and a general lack of knowledge affecting the well-being of our farm workers. In terms of marketing, we have to create products and services aimed at the target customer we want to reach. To do so, we must know our customers' tastes, preference, needs, and therefore adapt our products of service to the target population. Seeing the general need for knowledge of the local agricultural community by local agencies, institutions, and organizations, the EMSA program developed this research to provide tools and relevant information to help these organizations tailor their services for this specific community. We hope that many people reaching out to this community, taking the time to go through this document and thoughtfully embrace changes. The image that you are looking at is the front page of our study. We are the witnesses is the title we choose. Indigenous communities have been in the shadows for a long time. It is in everyone's hands that this changes. Justice is not equity. We need equity in the treatment we give to the members of these communities. The methodology and initial steps of the SDOH project start on November 2020. This ongoing project had 4 main components, which include 2 types of interviews, one with questions addressed to health providers and the other addressed to nurses. A survey covering 9 categories of social determinants of health. Secondary data collection and analysis along with the construction and an interactive online map carried out by 4 interns. And the planning and design of the delivery method for all the information generated by this report. The interview's content was reviewed by a faculty member who is part of the University of Washington Butler School of Nursing and Health Studies, and also the Department of Occupational and Environmental Health Science at the University of Washington School of Public Health. ENSA program staff conduct 11 interviews, 5 with medical providers, 1 of those with a specialist, 5 with nurses, and 1 with a healthcare assistant who belongs to the Mixteco community, one of the most representative groups of indigenous Mexican migrant communities in Skagit and Whatcom counties. All the 11 providers we interview are frequently in contact with farm worker patients. A report was made about the findings, common denominators, and relevant issues from the medical perspective and opportunities to improve the patient experience. You can find the compilation of the information collected during the interviews in an annex to the report. In this project, 10 promotores de salud, 3 community health workers, 3 staff members, and 4 university interns participated. The categories addressed during the investigation were education, economy and resources, housing and transportation, eating habits, mental health, health and lifestyle, substance abuse, safety, and pandemic. Many of them are impacted by external factors beyond the community's control. This is the demographic information of the social determinants of health research participants. We reached 305 farm workers. Of them, 114, the 37% were seasonal farm workers, that are those who have established a home in the area for the last 24 months or more. And 191, the 63% migrant farm workers who migrate to the area during the harvest season. 43% of them were men and 57% women, 24% between 24 and 32 years old, and 58% between 33 and 55 years old. The 89% were Mexican and 6% Guatemalan, 5% from other Central American countries. Of 305 participants, 2% were trilingual, 45 were bilingual in the indigenous language and Spanish, 8% monolingual in Mixteco, and 45% monolingual in Spanish. It's important to remember that 40% of the agricultural community of the Skagit and Whatcom counties is not indigenous. One of the 9 categories of the SDO research was education. The 50% of the participants were illiterate, 37% report low level of literacy, and only 10% of them report higher education. However, a total of 65 of 114 participants who had lived in the area for several years, seasonal farm workers, report that their children over the age of 18 have complete higher education. This shows that for the children of workers who establish a permanent home in the area, the opportunity for their children to attend college is greater compared to those who migrate from one place to another, the migrant farm workers. 50% of the participants report being unable to read or write in Spanish or any other language. Additionally, 9% report that they could read and write in their native language. However, we know those who write in their native language do so phonetically. We have seen that 2 or more people writing the same sentence in the same language do so differently. For this reason, writing communication in indigenous languages does not help convey a clear message. Most of the members of these communities don't know the grammatical structure of these languages, which make it not universal writing that everyone can understand. We have heard that some school districts and the DSHS organization send information writing in Mixteco to members of this community. This causes a big problem because organizations assume that the message was delivered unclear. The only thing that this causes is more confusion in communication and misunderstanding. Also, based on the fact that the Mixtec language has multiple variations and some of them are considerably different from each other, people cannot assume that everyone speaks the same variation. So far, we are aware there are 52 variations of the Mixteco language. There are indigenous Aztec and Mayan languages we have found in Skagit and Whatcom counties. The gray color identifies the Mexican states where these indigenous community members come from, and the yellow one, the Guatemalan state. For the new generations, those who are between 20 and 30 years old who migrate to the United States as children and who had the opportunity to attend school in this country, language is not an obstacle. Most of them are trilingual, with English being their second language and Spanish being their third. These are the family members who are and have been helping their parents by interpreting during medical appointments and using other community services. They belong to one culture but grew up in another and have appropriate and integrate both cultures into their life. This made them versatile and very necessary within organizations that offer services to the indigenous communities that live in the area. About the economy and resources, 83% of the participants report working at that moment. 71% work in fields and crops, 80% in packing processing plants, 10% in nurseries, and 1% in activities unrelated to agriculture. 17% were not working at that time. Seasonal farm workers experience fluctuation in the amount of work available to them. The picking season in Skagit and Whatcom counties is typically when the field crop workers earn most of their annual income and are employed. During the colder months, known as the low season, they often find themselves unemployed. The work during the low season is reduced to weeding, pruning, watering, planting, and preparing the land. Farm owners require much fewer people. Due to the reduction of work during the low season, many farm worker families have no other choice but to work up to 16 hours each day during the high season to save enough money to cover their expenses during the low season. Teenagers over 14 also work and contribute to the family economy. However, children 12 years of age are allowed to work limit hours with less pay. It is common to see at migrant camp children between 6 and 10 years of age taking care of their younger siblings while their parents and older siblings are working. About resources, answering the question in the past year, which things you need that you could not get, 72% of the answers were related to healthcare services. Also, 11% report a lack of food. With this in mind, and the fact that their annual income is often at or below the poverty level, farm worker families need to be informed about local food assistance programs and food banks. We asked about internet access as another resource. 48.5% of participants report having limited internet access, and 9.5% had no internet access. Transportation is one of the biggest barriers for many farm workers, especially those who migrate each summer to pick berry crops in Skagit and Whatcom counties. Many migrant farm workers arrive at temporary housing provided by the farm owner in a single vehicle with friends and or family members, leaving most of those who travel in that vehicle during the season without transportation. The farmer community is not a user of local public transportation. The reasons are multiple. Routes are sporadic and bus stops are far from rural areas. Many people would have to walk more than a mile to get to the bus stop. Not to mention that many times they have to go with children. Public service within the transportation system, both at the station and within the buses, is geared toward the English-speaking community. We also have to mention that many times police patrols frequent the area surrounding the bus station, a situation that intimidates the agricultural community to dare to use this service and discourage the idea of learning to navigate the local public transportation system. Survey respondents report that lack of transportation has prevented them from getting to 20% medical, dental, mental health appointments, 90% shopping for essential goods, 17% go to work, and 10% attend community gatherings. Housing is a fundamental human right. which should fulfill the premise of being a safe and comfortable place where we can rest, protect from the weather, protect from the dangers of the street, and a place we share with our families, our loved ones. It is natural for people to develop a sense of belonging with this space called home, not only because personal belongings are found there, but also family memories. For this reason, not having a place to call home ends up negatively affecting a person's mental, emotional, and physical health. The relationship between physical space and what that physical space represents has a very big implication for the stability of a person through their life. The high mobility of migrant workers forces them to share their homes with other people who don't not belong to their nuclear family. Living in overcrowded conditions increases the risk of creating family tensions, limiting privacy, and leading to depression, anxiety, and stress to the point of reaching domestic violence, triggering many other mental health issues that affect the children. The overcrowded conditions also increases the risk of exposure to contagious infections, diseases, virus, sexual abuse, violence, and harassment. 44% of respondents live in farm worker housing. We want to ask about their eating habits. 46% of the surveyed respondents answered they do not have a specific time to eat. Often, especially those who work in the fields, prefer to finish their assigned tasks before taking a break to eat and or hydrate. For many farm workers, it is more convenient in economic terms to avoid these time breaks because that means less money in their pocket, especially when they work by contract or by pieces. Here, the number of pounds of fruit that is picked is very relevant. Harvest time is limited, and it is the only opportunity during the year that migrant farm workers have to increase their income, which will help them sustain themselves through those months when the amount of work decreased considerably. There are other reasons why farm workers don't take their meal times regularly or take breaks more often. Also, the long hours of work often lead the farm workers to choose foods that give a feeling of fullness, but with low nutritional content. The quality of the food consumed becomes another cause of health problems. Nutrition, hydration, and active breaks during working hours determine factors in the health of human beings. Thinking about the long hours of exposure to the sun and the answers about how many times a day they hydrate are very worrying. 57% report drinking less than 4 glasses of water a day, and 3 participants say they don't drink water while working because this makes them go to the bathroom, and the bathroom facilities are often far from the field trenches where they work. Work in the fields is physically demanding, so it is necessary to obtain at least 8 hours of uninterrupted sleep to restore energy. It is common to hear from members of the community that they don't get the required hours of sleep because their days are full of work and chores at home and family interaction. Other comments also include financial and or family concerns. In many of these families, everyone sleeps in the same room, making it difficult to get a deep and restful sleep. Although farm workers burn many calories walking through the field trenches in high temperatures, this activity is not done with proper clothing or shoes that allow them to transpire and with regular hydration. Clearly, there is no encouragement to do healthy physical activity because the body is exhausted and abused. Agriculture workers are part of the population with low access to primary care health services. Low access is due to the cost of the service. Many farm workers either do not have health insurance because they are not eligible, and some are unaware of programs that can help them use health services. 70% of those surveyed report not having health insurance, and 2% had temporary health insurance due to pregnancy. The cost of health services discourage many from seeking routine preventive health appointments. This can often result in the community members seeking health services when they can no longer handle the discomfort or pain, which can be more expensive having to go to the ER. Indigenous beliefs around health, wellness, and disease are rooted in ancient Mayan and Aztec belief traditions that nature, society, the spirit world, and the cosmos are all interconnected. Heat illnesses are believed to cause excess of heat in the body, and cold illnesses are caused by excessive temperature loss. The key for good health is to balance heat and cold. The hot elements are associated with the sun, the sky, the masculine, order, light, and life. The cold elements are associated with the moon, the earth, the feminine, darkness, and death. Both are necessary for life. Like a plant, it needs the heat and light of the sun and the cold forces of the earth. Many illnesses are also attributed to supernatural causes such as evil spirits, the evil eye, and violation of taboos. Those who have lived for years in the US have learned to look to both Western medicine and their traditional healing practices. Other migrants or newcomers still rely heavily on their own traditions of seeking out healers. Local organizations and agencies serving members of this community have a responsibility to provide the support they need to navigate the system. This involves helping them fill out the application forms, providing interpretation services in their native language, and giving them the option to do any process to acquire services in person and by phone. Some members of the community require extra help. In these cases, one-to-one guidance is critical for these individuals to be able to use the general community services, especially in healthcare services. Preventive health is not part of the culture of indigenous communities. Their perspective on this is different. As a consequence, routine visits are not a priority for them. 10% of respondents report that the last time they saw a doctor was 4 or more years ago, and 5% had never seen a doctor. 50% of respondents report that the last time they saw a dentist was 4 or more years ago, and 18 had never seen a dentist. 7% surveyed responded that in the last year they had used prescription drugs in a way that they should not be used. We had heard from some members of the community who have received medical prescription for pain pills, which in addition to relieving pain, help them experience a sense of happiness, forget about problems, and better resist physical exertion, making work days less difficult. For this reason, they want to continue taking them permanently. Heavy lifting, prolonged kneeling, constant bending and twisting, and repetitive movements all lead to musculoskeletal and traumatic injuries. Between 2008 and 2010, 50% of all contract farm worker injuries were classified as strains or sprains. It is understandable why farm workers use pain medication more and more frequently. About alcohol consumption, respondents were asked, how many times in the last 12 months had you had 4 or more alcoholic drinks per day? 30 people report doing it monthly, 50 weekly to daily. Cultural traditions and social attitudes towards alcohol, as well as the norms and belief system of an ethnic group, are reflected in the way individuals drink. This determines what is considered acceptable behavior, both in the family context as well as in the community and in social interaction. Culturally, the Latino community has weakened social habits where most of the time alcohol is consumed. The alcohol consumption is normalized depending on gender. It is not bad for a man to get drunk, but it's very frowned upon for a woman to do so. Then we would say that there is a cultural background in the Latino, indigenous, non-indigenous communities related to alcohol consumption. About drug use in the Social determinants of health survey, 6 people report having used marijuana in the past year, and 7 people report having used any of these drugs, heroin, cocaine, amphetamine, hallucinants, or others. A category was included about safety in family relationships and home and at work. Some of the questions include addressing safety in family relationships where in the last year, has someone in your family physically hurt, insult, and or threatened you? 29.5% of the participants answered this question affirmatively, 41% men and 59% women. In the last year, have you been afraid of your partner or ex-partner? 5% of the participants answered this question affirmatively, 43% men and 57% women. Intrafamily security is made up of a series of rules and behaviors aimed at minimizing, controlling, and neutralizing situations of violence that all family members should fulfill. However, these rules and behaviors are not taught and therefore are not practiced, nor do they give the importance that this requires. For this reason, by the ignorance of what is good behavior and based on example, which is the best way to teach, is that the agricultural worker is frequently involved in situations of violence and interfamily insecurity. We mentioned the example because violence is a present element almost normalized and that all family members end up accepting, not because they think it is okay, but because the fear generated through these behaviors invalidates the defense action, making the situation something that has to be endured, especially for women. Working in male-dominated environments and in some cases being undocumented exposes female farm workers to sexual harassment and even worse rape. The fact of having language barriers and living in isolation prevents them from making use of their rights. One of the questions in the SDOH survey was formulated as follows. Stress means a situation in which a person feels tense, restless, nervous, or anxious, or cannot sleep at night because of worry or too many things on their minds. Do you feel this kind of stress these days? Survey participants answered. Some days 33%, many days 6%. Discrimination, extreme poverty, languages, and all the challenges associated with the condition of agricultural work, such as exposure to the element dangerous work, inadequate housing, social isolation, and lack of transportation, among others, made the work of the farm worker full of insecure areas. The life of the agricultural worker is a life of many physical efforts, sacrifices, long hours of work, little rest, lack of entertainment, very basic food, lack of care, lack of preventive health, no right to vacation, economic restrictions, among many others, factors that lead them to suffer from depression and anxiety. The last category we addressed was the pandemic. 78% of those surveyed report having received the COVID-19 vaccine and 22% answered that they had not. Some of the reasons they mentioned why they do not get the vaccine were because of fear, afraid to die, 11% prefer not answer. Government institutions established preventive health measures for the population, including farm workers. Unfortunately, the housing condition of agricultural workers don't have the characteristics to be able to fully comply with preventive measures such as social distancing. It is a contradictory to think that farm workers are essential workers were even more vulnerable in the pandemic than the rest of the population called essential workers. Before, it was difficult for them to deal with so many barriers. Now, they had to expose themselves without having personal protective equipment at their disposal. Often transporting with many people in a single vehicle, and to this was added that they had to share very small spaces in their homes. The economic factor was also affected because the students had to have school at home. In a family with 2 working parents, only one could work. thus reducing their income by half. The roots of vaccine insecure for the vast majority of indigenous farm workers we have reached go beyond this pandemic, starting from the simple fact that in their languages, the concept of pandemic or vaccine doesn't exist. Things will not change overnight. This is more than just hesitancy about vaccine. It is about language, culture, worldview, collective trauma, and current and past barriers. Thanks to the pandemic, many local organizations have become actively involved with the farm worker community. The Promotores de Salud have worked with public health in different initiatives, indigenous language translation, embedded in videos used to guide the community on how to navigate the COVID-19 testing and vaccination sites, reaching the community and non-exclusive COVID vaccination events, and bringing resources to Latino neighborhoods.
Wonderful.
It was a lot of information that is not easy to absorb in 30 minutes. I know if you
Thank you, Marcela. It was helpful.
Thank you.
Thank you, Marcela. I want to thank CMAR Community Health. I want to thank your efforts doing this important work. And I think this presentation was wonderful. If we have any questions, we'll be sending them to you, and maybe we could send some answers back to some of our folks that have been asking questions. So thank you so much.